About a quarter of healthy people is salt sensitive. And although they don't have chronic hypertension, the blood pressure spikes when they eat salt. Interestingly, such spikes are more common in cardiovascular patients. It turns out, not just every fourth, but every second person with high blood pressure is salt sensitive. And that means we need to take salt sensitivity as a subtle warning about underlying cardiovascular risk, regardless of blood pressure numbers. So what's special about salt sensitivity, and why does it affect only some people and not everyone? Let's see. Normally, excess sodium is flushed out daily by the kidneys. That's what the kidneys are supposed to do. If sodium is retained, many health professionals automatically look at the kidneys as if it's their fault. But kidneys don't make decisions on their own. They communicate with other systems regarding sodium balance. For example, they read signals sent from adrenals, sympathetic nervous system, and even blood vessels. So when sodium balance is upset, it may not necessarily be the kidney's fault. Kidneys simply may be getting unusual directives from other systems. And this is where things get really interesting. Studies revealed that in salt-sensitive individuals, sodium accumulates in the lining of the blood vessels. In other words, arteries collect a large amount of sodium inside themselves. This sodium hoarding behavior is exactly what has been linked to development of salt sensitivity. But why would blood vessels want to hang on to extra sodium? Just to give us blood pressure spikes? No, that's apparently not the case. Blood vessels do that to protect the skin. What? Too much salt isn't good for the skin. It can lead to dehydration, and that can lead to dry, cracked skin. Cracked skin is not just painful or unpalatable. It is a serious breach of our protective barriers and can lead to infection. That's dangerous. Now, you can clearly see why overloading skin with sodium may be dangerous and why skin may ask blood vessels for help. Salt accumulation in the skin doesn't just make it dry. It also has other ramifications. It is said to contribute to skin inflammation and aggravate inflammatory conditions such as acne, eczema, or psoriasis. These skin conditions can also lead to infection. Skin and blood vessels keep a very tight communication between each other. They work as a team to maintain proper ratio of electrolytes in the body, especially if the kidneys are not that good with sodium excretion. Here's a thought. If your blood pressure spikes after chips or bacon, your blood vessels may be hoarding sodium. And that's because your skin is oversalted. Is your skin dry and cracked? Something to think about. This puts your skin moisturized on the back burner. Salt-sensitive patients are told to avoid salt. This sounds reasonable if you believe that salt caused hypertension in the first place. But that's seldom ever the case. Salt is essential, and we need it. It's not a devil looking to kill our hearts. How about instead of avoiding salt, the nutrient you need, you unblock your skin? I think that will make far more sense, at least to me. And by unblocking the skin, I don't mean taking off your clothes and parading in a mall. I mean something else. Making your skin sweat. Sweating is a natural sodium remover. Sweat is salty because it contains sodium. Duh! Athletes can lose as much as 2,300 milligrams of sodium in a liter of sweat. That's like a tea teaspoon of salt in 4 cups. So here it is. If you sweat a lot, you have much lower chances of collecting salt in your skin and consequently in your blood vessels. And that makes you less salt sensitive, which in turn makes you less prone to hypertension. Guess what? What makes skin sweat? Exercise. What is good for high blood pressure? Exercise. What's good for reducing inflammation? Exercise. What's good for sodium sensitivity? Exercise. So if you have any inclination for hypertension and dry skin, maybe it's time to start some sweaty exercise routine. Just saying. Don't let your skin ditch all the work into the circulation. Is your heart. Subscribe not to miss our future videos because healthcare is self-care. Let me do some push-ups.